From big hospital chains to pharma companies, and now a vibrant startup ecosystem brimming with ideas. Every player in this ecosystem is exploring new ways to leverage the cloud to drive positive outcomes for patients and drive sustainable growth. But achieving those goals requires a plan of action to make data work for the enterprise. So today, we bring to you the blueprint of reimagining healthcare with the cloud. I'm your host, Gautam Srinivasan, and joining me on Money Control Innovation Next, presented by Google Cloud, to talk about thinking beyond traditional health systems are a host of industry leaders with different specialities in the healthcare space. Let me quickly introduce them to you, starting with Suresh Ramu, CEO and co founder of SiteCare Cancer Hospital, Deepak Gandotra, Senior Director for the Clinical Business at Indegene, Shivankar Pramanik, Deputy CIO and Senior Director at Manipal Health Enterprises, and Siddharth Bagga, who looks after healthcare and life sciences enterprise sales at Google Cloud. Thank you, everyone, for joining us in this very, very important and what looks like a wide ranging conversation. So let's start with the broad overview. I'll come to you for that, Siddharth. How is the cloud transforming the healthcare industry by addressing, say, challenges around costs, ease of access, interoperability, scaling, and compliance? Give us a sort of a broad overview on the role of cloud platforms in healthcare.
uh, Before I address how cloud is transforming the healthcare industry, right? Let's first understand, what is it that is challenging the healthcare industry, right? And then we can get to how cloud really helps, right? So if you look at in the provider segment, right, in the hospital segments where doctors and patients interact, look at the traditional experience, right, that exists. A patient goes in with an ailment, a doctor has a consult for 5 minutes, doctor does his diagnosis, which is completely dependent on how the doctor perceives the patient's health, prescribes the medicine, the patient goes home, orders the medicine online or goes to a pharmacy, purchases the medicine, gets well, and basically that's the end of it, right? Or if a patient goes in for a test, understands he has diabetes, then that's a big shock to them. They kind of go to a doctor says medicine, do a test every 3 months, and then that's it, right? But look at how with the new age technology, new age companies that are coming on, how digital health is really helping patients move from a spectrum of illness to wellness, right? If you look at a chronic patient who has diabetes, uh, and if you see some of the new age companies today trying to understand that patient better, trying to understand when is the next test due for the patient every 3 months, his supply of medicines, do they need to be fulfilled every month, right? Looking at smart watches, understanding patient data better, understanding the adherence to treatment, and so on and so forth, right? So where cloud really comes in is helping companies really transform digitally and understanding their patients better, understanding the patient data better, and also helping doctors diagnose patients with a set of consistency today that that can really help to improve the overall wellness of the patient, right? uh, Cloud really helps in two aspects, in my mind, right? One is it helps you with speed of innovation, right? And it helps you with the speed of software delivery, right? Because traditionally software delivery in healthcare is so far away from what today uh, a fintech company does, right? Or what a retail company does, because ultimately the patient is also a consumer of retail services. The same patient is buying clothes, right? But ultimately the experience they get on a smartphone is so different today from what neobank is able to provide, as an example, right? So cloud really comes in to help you understand your patient data better, innovate on it by building AI machine learning, without the constraints of infrastructure or not having the ability to understand AI machine learning, right? Cloud today, and especially Google Cloud today, has products that are built around and solutions that are built around the healthcare ecosystem to help you jumpstart your journey on AI machine learning and innovation. And then secondly, provide you with infrastructure and application delivery at scale that allows you to really launch features every 2 weeks, right, to your end customers, so that they're able to really see changes that impact them directly and take control of their health, so that they can move from the spectrum of illness to wellness, right? And all cloud today, especially Google Cloud, is completely HIPAA compliant. We adhere to GXP, so patient data is secure. Uh, De-identified data is available. You can really do a lot of innovation on the data that exists today, and then you can move your data to a common standard like FHIR, using what Google Cloud has, which is healthcare API, to really look at your legacy interoperability standards and move it to FHIR, such that you can then use the power of technology to really then build innovation on top of that.
Indeed, in that patient journey from illness to wellness, it's interesting to see how the cloud unlocks innovation and, of course, speed of software delivery, as you said, because these days the expectation of experience is that the customer is used, or the patient rather, is used to a certain retail like experience in whatever they do in real life. And why should healthcare be behind? So, all these developments coming into fore to make the patient experience easier, seamless, and for the say healthcare providers to personalize at scales. Let's get in some use cases as well to understand the true impact of technology across delivery in the healthcare space. So Suresh, we'll come to you for that, because digitization of healthcare, that can improve quality and accessibility of cancer care, since oncology has a lot of moving parts, and there's a lot more focus required to solve the issues. And when we look at digitization, it allows you to capture, connect, contextualize, process, and analyze data in ways which were not possible until recently. So take us through the advances in big data and AI that Sidecare has capitalized on to improve its value proposition.
Well, I think it's if you go back to what Siddharth said, and I like to take off on that in terms of patient experience and the patient journey that we are talking about. Really, it is important to understand what the patient and their family is looking for, and they're looking for cure. They're looking for better clinical outcomes. So I think that is really something that we must always place at the topmost in terms of what we are looking for. Patient experience that surrounds that whole process needs to be far more superior in terms, and there are obvious comparisons with everything else that is happening in the retail sector. And healthcare is far behind really, and but it's catching up. It's catching up in a variety of different ways. But to understand healthcare, we must look at the three or four different parts of it. One is diagnostics, which is when you're suspecting something, you want to be sure, you want to know what is the treatment that is required, which is the second phase. The treatment phase is a long phase of experience for the patient. People want to get out of it, get cured, and there is a post-treatment follow-up phase for the patient that need to be followed up. So if you look at diagnostics, there's a lot that has happened in terms of imaging, for example. So you look at radiology, which is a great example where we are seeing a utilization of pattern recognition and AI tools and machine learning to basically give rapid results so you walk in, do a scan, you come out, you have the report ready. That's the expectation that a patient would normally have, right? Because they're anxious already to know what's going on. The scan itself is becoming faster now because of a lot of software. The hardware is optimized. It's far better experience that is there now today. But you want the report out there as quickly as possible. And that is where I think technology is playing a role. For example, if you look at CT scans, if you look at MRIs, X-rays, you already have a lot of software tools that tell you what is happening. The
Hmm.
markers for the tumors, the identification, the patterns are already there. You look at pathology. Digital pathology is growing in a big way. The patient goes through a biopsy or through a surgery, and you want to know what exactly the tumor is all about. Now you don't have the time to ship the tissue to an expert. So digital pathology is coming in a big way. We partner with several hospitals now into trying to get the samples directly, physically. And what we are moving towards is actually installing digital path in a variety of locations so that we can get those images scanned in so our expert pathologists can review or provide second opinion. So again, it's speed, it's quality at your
Hmm.
fingertips, and the patient experience is significantly enhanced. In
And
treatment, that's a
Suresh, what
whole
about data standardization? Because as Siddharth
yeah.
said, moving to an FHIR format that would solve a lot of problems because we still see a lot of data silos being built up because radiology doesn't speak in the same data language as, let's say, histopathology. So, what are the trends being taken? What are the trends shaping this space, especially when we look at data standardization, so that you can truly unlock the benefits of the cloud and say capitalize on innovation and the speed of software delivery that Siddharth had mentioned.
So data standardization has been a topic for the last at least 2.5, 3 decades, and I think one of the bottlenecks has been adoption, and in terms of the need for adoption, right? In a country where you pay for your healthcare versus it being largely insured or payer based, you have limited control in terms of what each delivery provider does. But that is changing. I think the government is taking tremendous initiatives to actually install standards and mandate standards. In fact, over the next 5 years, I think that's going to be obvious and visible. There are a lot of interoperable standards already defined in terms of how you explain something that can be utilized in a different context, in a different setting. And accumulation of records, integration of records. I think that is the other thing that becomes necessary, because you're moving between various providers or various machines or various services. And if you look at treatment itself, the life cycle of treatment, whether it is surgery or medical oncology or chemotherapy or immunotherapy or radiation therapy, again, these are different modalities, different treatments, different services. But from a patient perspective, they want to know where they are headed, what's their experience, what's happening to them in terms of the disease condition and progression or no progression. And there is a lot that we are doing in terms of integrating that data to look forward to almost predict what can happen. There's a lot of biomarkers and genetic analysis that is now coming in and getting integrated, which was never happening before. And we're seeing that enormous volume of data that is coming in every single patient record.
And we'll focus on those interoperability issues, resolving those interoperability issues a bit later in the show. Before that, though, let me move on quickly to Deepak to understand the use case from the Indegene perspective. Because Deepak, from both a patient and clinical sites perspective, I want to know from you, how has Indegene leveraged the power of the cloud to overcome unique challenges in your space, say like slow patient enrollment and achieving patient numbers while running clinical trials? So take us through some next generation recruitment approaches being enabled via digitization.
Thanks for having me, Gautam. I think COVID has had thrown everything out of the gear. There were more than 6,000 clinical trials that got paused or stopped during the peak of COVID-19. But the silver lining there was that we got acquainted with and a lot of acceleration on leveraging digital tools and techniques for patient engagement, patient recruitment, site activation, and across the board, all stakeholders is something that the industry became normalized with. At Indegene, being a digital transformation partners to care providers and clinical trial sponsors, we have been working on a lot of these channels, including online, social media, search, patient advocacy groups. But as Suresh mentioned, depending on which patient you are looking at, for cancer patients, it's important to address their anxieties and emotional components, as there are advances on the care side. So leveraging virtual nurse concierge, virtual medical science liaisons, using cloud infrastructure to deploy instant communication to these patients, telling them about the next step in their clinical trial journey, and broadly using digital tools to improve the experience of all stakeholders, and most importantly, keeping patient at the center of this clinical trial design is what the pandemic has shown us. And the industry is moving towards decentralized trial, and more of this is being seen in the form of hybrid trials. Um, but I would just like to call out another aspect, which we've all seen that COVID has shrunk the timeline of a clinical trial, which was usually 5 to 7 years, and we have seen it can be done for 1 year for COVID-19, which is something that all of us should be proud of. But how do we keep challenging ourselves to make sure that we better things, while not move fast and break things, but how do we improve ourselves is the next set of challenges ahead of us.
Hmm. And what about, say, what the ecosystem does in order to help you achieve those objectives? Because, as you said, the timeline for clinical trials that has shrunk significantly. So, what about, say, initiatives like the Ayushman Bharat Health Mission, where everyone is given a sort of a health identifier number? How do those moves help you and your ecosystem? What's going to be the impact in your opinion?
I think that's a very important point, and it plays across regions. There are cultural nuances, of course, language and ethnicity. They all play an important role. But cloud gives us the advantage of centralizing a lot of intelligence behind it, while all of these operations can be decentralized. Ayushman Bharat, and we have seen the similar story play out in other regions as well, is a very strong initiative to standardize data, behavior, and most importantly, the interoperability between stakeholders who are providing care. Uh, we look at the lack of interoperability when we actually try to solve the problem. There are two stakeholders, so to speak. Those who think that there is not enough ROI in being interoperable. And for them, we need to show the ROI. Cloud is doing its bit in that. And then there are people who think that there is so much power in ROI or the data that they do not want to share it with others. So that is where we need to increase the pie. And initiatives like Ayushman Bharat, where all the patient data, of course, being in a secure and safe manner, is such an important initiative to improve patient care, wellness, preventive measures. So across the board, I think these initiatives are something of immense value and to be unlocked over the next decades or more.
Shavankar, coming to you, what sort of investments will you be looking at to make in, say, digital technologies at Manipal Health Enterprises to improve internal processes and increase productivity? And how will all of it tie in to drive positive patient outcomes and experiences?
Thanks for the questions. Definitely nowadays companies are investing digital investment index already used, but the problem is proper digital strategy within the organizations. Investment is there, but the strategy, lack of strategy fails to kind of digital transformations in many aspects. So first of all, we have to understand what is digital transformations is. To put it simply, digital transformations is the adoptions and integrations of digital technologies to transform all area of the business, and as well as the culture change also. Majorly, it is a culture change within the organizations, and it will give you immense success to digital transformations projects also. So to and it will also helps kind of to create collaborative landscape within the organizations also. If I give the simple examples, like you can change employee onboarding for the digital transformations, and secondly, to make your internal employee, because they are another customer within your organizations, to make those internal employee a kind of digital knowledge they should have, what this product is going to be and how they will be helpful from this product. So that kind of culture change we need to change within the organizations.
Let's now understand some cloud migration journeys, because there is still a lot of legacy left in the healthcare system. And Siddharth, I'll bring you into the conversation again to kind of get your views on that, because moving to the cloud is a is a transformative and massive shift for any enterprise. So when it comes to the healthcare ecosystem, in your opinion, what are the essential tenets of planning a cloud migration journey from an infrastructure lens, especially for enterprises who are grappling with legacy issues, as I mentioned earlier?
Thanks, Gautam. That's not an easy question to answer, but it's a great question, right? And we get asked a lot about how does an enterprise that has a lot of legacy applications, legacy systems, really look at their cloud journey, right? And I would actually break this out into two parts, right? One is on the infrastructure application modernization side, right? Now, if you ask me, a healthcare company or a pharma company, should not be in the business of managing infrastructure, right? The business is to deliver healthcare, quality healthcare, or deliver quality medicines at a low cost, especially in India, when you look at generics, to end patients, right? So when you really look at legacy infrastructure, right, you should be really asking yourself the question of, hey, should I really look at managing a data center? And probably the answer you'll get is no, right? Because traditionally, there was a lot of fear around, hey, is the cloud compliant, is my data secure, and so on and so forth, right? And if you really look at the recent last 3 to 4 or 5 years, it has been proven again and again that the security that cloud providers like Google Cloud put into place at every layer, right, of their infrastructure is far superior than what an enterprise can do at their data center, right? So when you really look at cloud transformation, right, or infrastructure transformation, you have to look at the 3 R's, right, which is basically rehost, replatform, and re-architect, right? So there will be applications today that will be sitting on legacy hardware that you are managing, that can be really taken to the cloud as a rehost, right? What we call is lift and shift. Classic example would be an SAP application today that you are running in your data center, right? And if you are looking to take that SAP, move to an S4 HANA or whatever the case may be, that transformation should happen on the cloud, because the infrastructure today is far superior in the cloud. It is built for scale, right? And most importantly, what you'll be doing is unlocking the data, right, that sits within your SAP systems to drive innovation within your enterprise, right? So you can start building out really cool metrics in BI to really look at order to cash. You can look at things around financial planning and so on and so forth, right? And we have customers today in the pharma space doing this with us, right? When you look at the hospital systems, right, and the healthcare systems, and Suresh can obviously weigh in here, but what we've seen that a lot of the EHRs or the hospital information systems that sit today in the infrastructure will continue to stay there, right? What we're really seeing is, healthcare providers actually wanting to understand patient data better, right? They want to understand how can they help their patients better. And we're seeing a lot of secondary data layers being built on the cloud, where you're taking the legacy system, leaving it the way it is, right? But really using the data that is coming there from that system, and then merging that with other data sets, right? To really see how can you help patients in their journey, right? So on the infrastructure side, I would say rehost, replatform, re-architect, and you really break down your entire spread of data center in those buckets, right? The second portion of this is around innovation, right? The biggest currency today in healthcare is data, right? And unfortunately, the data is siloed, right? You should look at moving your data into the cloud ASAP, right? And so that you can really break the silos and really look at doing innovation on the cloud, right? Once your data is on the cloud, right, the possibilities of driving innovation are endless. You can look at building models around AI machine learning to help your patients understand their health better, to help doctors understand their patients better. You can build innovation around your R&D data in a pharma company, or your SAP data. You can look at how can you manufacture drugs in a faster manner, how can you do your filings faster, right, based on historical errors that you've had. So the opportunities are endless. So really, two portions: infrastructure application modernization is the first step. Data is a journey that you should undertake sooner than later, because it can really impact, and the cloud provides you the scale. And with Google Cloud today, we have solutions that are built for both healthcare and pharma companies to really help you fast track your journey, move your data in a secure manner, secure your infrastructure in a much better fashion, be compliant to HIPAA and GXP, and so on and so forth.
Indeed. And taking the point of removing data silos forward, I want to bring interoperability back into focus in this discussion, since it was mentioned earlier, because poor consideration for the end user, starting from misunderstanding their needs, skipping their training, and not providing support, that leads to poor adoption or inappropriate usage or waste of resources. So maybe Suresh, Deepak, and Siddharth, you can share your views on how enterprises can solve interoperability issues to improve adoption of digital initiatives in healthcare. Suresh, we'll start with you.
Yeah, clearly, if you look at the number of systems, and I think what Siddharth referred to, we are dealing with a lot of legacy systems, right? We are moving, for example, a lot of things on the cloud, and we have taken a position to say we will not develop software, we will not host and manage hardware and software inside a hospital. We are not the experts. I think the hospital really needs to figure out, and it's a complex enough task to figure out what you need to do in terms of diagnostics, treatment, and care, and managing and enhancing the patient experience. So that's what we are focused on. But if you look at the number of systems, I think that's one of the big complexities that we need to understand. And systems have been built largely for managing the transactions. If you look at healthcare systems in India, they were for purposes of billing, or registration, or knowing that the patient has taken an appointment, but not to really capture the electronic medical record itself. Now we've moved. We've been using systems for the last 6 years. We have all our outpatient, inpatient data electronically available. But a lot of those systems were text based, or did not have enough fields that you can use to mine that information. Of course, with now machine learning, you're able to even mine information from text, and we are actually using that power to know what is happening in terms of outcomes for our patients. But we're talking about lab systems, radiation systems, chemotherapy systems. We're talking about surgical and robotic systems. We're talking about outpatient data, which is different. We're talking about financial data, which is different. We're talking about inventory management, which is different. We have a smart ICU here with AI-based tools for looking into what is happening at the ICU at a back end, so that alerts are given to our intensivists more real time, rather than a physical medium, so that the care levels are significantly better in the clinical sense. But again, that's a different system. So you need to now integrate and look at it holistically from a patient perspective, because all of these are different episodes at best. Most often they are just transactions, but a patient is a life cycle, right? You need to manage the patient journey essentially as a life cycle. You need to know the entire life cycle as a, not just being, and you need to be able to stitch that together. And that's where the struggle today is, in terms of interoperability.
All right, Deepak, your thoughts on this? As Suresh mentioned, the struggle is weaving together different parts of the patient journey. Your thoughts on how enterprises in the healthcare space can resolve interoperability issues, maybe from your experience in the clinical trial space.
Sure, Gautam. So I'll start with keeping patient in the front and center. I'll share a quick story. My mother was visiting Bangalore, and we went to a famous hospital in South Bangalore. She got an X-ray done, and the hospital refused to give us the X-ray. We were able to resolve that issue by escalation, etc. But the point I'm trying to make here is that interoperability needs to be looked at from multiple stakeholders' perspective. Of course, keeping the patient front and center. Um, when we look at different data providers, we look at the role that regulatory can play, and the hospital networks that are leveraging interoperability. I think India is India is uniquely poised, and I would like to draw parallels with what happened few decades back in the US, for example, in retail. India, if we compare the retail journey, we leapfrog the fragmented retail into an organized retail, and we directly jump to a large extent into e-commerce. Similarly, in healthcare also, we are in a very unique position where we have the technology powerhouses, we have the infrastructure support, and I think the writing is on the wall. We have done some successful pilots. You were talking about Ayushman Bharat initially in union territories, etc. To be able to really create a system which is standardized and incentivize all stakeholders, including care providers, insurance, lab operators, and of course the patients. Easier said than done. There will be a lot of behavior changes that would be required, and government can needs to play a very important role, probably more than what fintech and e-commerce require, because lives are at stake. But it's a very important phase in time of our journey towards interoperability.
All right, Shivankar, what are the do's and don'ts in sort of generating the right kind of impact for projects moving from pilot stage to broader deployment enabled by the cloud that you advise, considering the nuances at play in a very highly regulated healthcare sector?
Successful pilot starts by defining business problem. Don't end up with the answers looking the questions. And many of the pilot projects don't fail because they get started for several reasons, and lack of top-down support and lack of fund. They failed within the organizations. You need exclusively an executive champion who have the right of funding and the right of kind of change catalyst also. So initiating any projects from your middle of the organizations, your lower of the organizations, will have the lesser chance to fail those digital projects. And the most successful projects happen when CIO has the executive support and with the commitment to fund the projects. And from POCs, we experiment with learn and dimensions of the scale of the technical and project delivery also. So for CIOs, we should have an inside view of the applications, how that applications can scale widely. I can give you an examples like someone has started some image automations for the neurology department as a POC. That project can scale up for the cardiology department, but that kind of insight of that product CIO should carry. Otherwise, it will definitely fail projects for that PSC.
Siddharth, let me come to you for the enablers perspective on resolving interoperability issues. Where are the data gaps and how can they be resolved?
Sure. So, at Google Cloud, right, we have taken a stand saying that, we believe that FHIR or FIRE will help solve a lot of the interoperability challenges, right? And all the investments that we're doing around building healthcare solutions are built around FIRE, right? Primarily, we have two solutions around healthcare API and what we call as healthcare data engine, right? Where we allow you to bring in data in any format, HL7, DICOM, and FHIR. Soon we'll have a few more standards coming in, where we allow you to bring all of this data together, create your stores, and then transform all of this data into FHIR, right? I believe it's a technology today that will fundamentally impact the healthcare system across the globe, right? We're already seeing some very good success in the US. So if you look at some of the largest healthcare names in the US, I can't take a lot of names without uh, you know checking internally first, but essentially public names, right, that are today working with Google Cloud, like a Mayo Clinic, which is a public case study where they're using Google Cloud today to really standardize all of this data across FHIR, right? And what that really does is creates a layer of data that can be exposed securely through APIs that can then allow you to build smart on fire applications on top of this, allow you to use this data for upstream analytics, allow you to build AI machine learning models on it, right? And we've created this ecosystem where we help you take your data, we help you transform it to fire, we help you to push this data into Google Cloud's data warehouse, which is called BigQuery, to run your analytics, right? We're seeing success of that in India as well. We've just signed a partnership which has become public with Manipal hospitals. It was all over the news, and we're helping them build out this data lake, this data environment, which will then allow them to leapfrog a lot of their applications and the innovation that they're trying to do, right? So we believe that FHIR will be the interoperability standard of the future, and we're investing heavily into building products and solutions to help our customers along that journey.
All right, you've spoken about innovation. Let's extend the discussion there and understand how the right kind of experimentation can lead to more innovation, and the understand the do's and don'ts in, let's say, generating the right kind of impact for projects which move from pilot stage to broader deployment enabled by the cloud. Deepak, what would you advise here, considering the nuances at play in a highly regulated healthcare sector? When we look at experimentation, it's very necessary to test and pilot projects and then move them to broader deployment. The do's and don'ts that you would suggest.
Yeah, I think that's a very important and often overlooked aspect, Gautam. What we really need to make sure is when we are beginning those pilots, we need to understand how the success of that pilot would look like during the pilot stage, during scale up, and making sure that all stakeholders are aligned. And I typically suggest, and what we often recommend our clients to do at Indigene is set up a war room of sorts where we have all stakeholders from IT, business, operations, to make sure that everyone is aligned and we have a point of contact to ensure that the pilot, when it is scaling up, as we were discussing earlier around challenges, sometimes unforeseen challenges around scalability, security, making sure that there are softer aspects around culture, around user adoption. All of those things need to be taken into consideration. In order to design a right scale up plan, it's important to make sure that all the stakeholders are on the same page and we are chasing the joint success, which is something that we believe that digital is a hygiene factor now. It's not about whether or not we are leveraging digital transformation, which is something that we recently saw in our digital summit, also being called out by a lot of pharmaceutical leaders across the board. What we believe is that it's not about it's the pace at which we are leveraging digital. The laggards versus the people who are moving fast forward. How do we bring all the stakeholders together by creating the right incentive plan and structure around it?
All right, Suresh, your thoughts on this?
What we are doing, we feel that from a technology standpoint, there are a tremendous number of solutions and a lot of innovations that is happening, right? And the infrastructure, the environment is rapidly changing. 5G coming in now, but you're seeing smaller and smaller infrastructures. You're seeing the size of everything that is reducing really, which allows for more mobility. There is a lot that is therefore changing the way healthcare delivery is happening. But when you actually look at it from a delivery standpoint, a services delivery standpoint, and from a patient standpoint, often we find that software providers or hardware developers do not actually understand the space so well. So what we are doing is to allow them to immerse into our environment. Really, we have opened up the hospital for internships, observerships, for a variety of people. People with no experience at all in the industry or nothing, but they just want to observe and learn. Also companies to observe and immerse in terms of understanding what a hospital is all about, what patient journeys really mean. I mean, not just theoretically looking at it or personal experiences driving. Very often we talk about one-off personal experience driving product development. That's really very risky, I think. So allowing the companies to immerse into the environment, I believe, genuinely changes the way innovation happens. So we're doing a lot of that at
Mm.
SiteCare.
Shivankar, with advances in telemedicine, is the biggest paradigm shift enabled by technology going to be a more decentralized approach with remote or home based care using, say, sensors and devices, and hospitals being sort of reserved for surgeries, or acting as a command center using cloud based solutions for remote monitoring and analysis of patients? How is Manipal Health Enterprises geared for the shift to minimum care in hospitals and maximum care at homes?
Yeah, telemedicine nowadays is kind of a separate business line for any organization. It's not only Manipal. Many of the organizations have adopt these telemedicines in different way. Base service for the telemedicine is like a teleconsultations part, and there are certain hospitals like Manipal who has an advanced telemedicine product where sensor-based monitoring systems is already embedded within the telemedicine product also. And now we can incorporate home care in the home care app also, telemedicine product also. So it's a totally separate business line, and it is as our sensor-based technology improves and develops, this telemedicine platform will develop rigorously.
Absolutely. And I want to expand this conversation around innovation to not just focus on patient experience, but also provider experience, because clinician burnout is also a key issue here. So, Siddharth, let me bring you in. What are the use cases where AI and automation is enabling a sort of a win win situation from both the patient and provider experience to overall reduce the burden of care?
I think that's a great question, right? I think if you really look at it, a patient goes to a hospital or a digital platform only because they are guaranteed a clinical outcome, right? So the reason that you would choose provider X or platform Y is because you're assured that the outcome is going to be guaranteed, right? Now, uh, the outcome is really guaranteed because of the way the doctor has diagnosed you, or the way he's looked at your health, right? We are seeing today, customers of ours today that are really taking this to the next level, right? So, if you really see, they're trying to build platforms today that and using AI machine learning on Google Cloud to help doctors understand and diagnose their patients at the same level of care, right? So that a doctor with 25 years of experience versus a doctor with 2 years of experience is looking at the patient data the same way, is the system is assisting him with care pathways in trying to tell him that, hey, these are the three possible diagnoses that could be possible. This is what you should do in terms of lab care. This is what you should do in terms of what tests they can do. These are the kind of antibiotics you can prescribe, and so on and so forth, right? So I think helping doctors and clinicians understand their patients better and diagnose patients in a more accurate way, right, is a real transformation that we're seeing with some of our customers that are actually taking the journey, right? The second aspect we're seeing around helping reduce provider burnout, right? And it need not be just doctor burnout, right? Is around conversational AI, right? So with Google Cloud today, you can build conversational AI in about 8 regional languages in India, right? And we're really seeing some of our customers leverage this quite heavily because administrative burnout of hospitals is another real challenge, right? So things like booking appointments, FAQs, uh, so on and so forth, right, can really be done through conversational AI, which is omni-channel, right? So you can use the conversational AI to integrate with WhatsApp, to integrate with Facebook Messenger, with Google Chat, so on and so forth, right? So those are some areas where we're seeing that we're really working along with our customers to help them reduce doctor burnout, clinician burnout, right? The third area that really got accelerated during COVID-19 was this entire fatigue that doctors had with diagnosing patients and so on and so forth, right? So telehealth played a major role in that, right? So we did two things at Google Cloud, right? One is Google Workspace today allows doctors to really look at seamless care, where you can open a document on your phone, understand, get the same experience that you would get on your laptop, do a teleconsult with Google Meet on your phone, on your laptop, without having to really look at which device you're looking at, right? Without having to worry about, hey, is the experience broken, right? The second thing that we really did to prevent this is that we invested in a company called Amwell, and it's public news. Uh, uh, they are they're a company that specializes in building telehealth solutions, and we primarily started with that in the US, and now we brought that to India as well. So if you look at the release that Manipal Hospitals did with Google Cloud, it very clearly says that they will be building their telehealth business and teleconsult business with Amwell, right? Really looking at how they can reduce physician burnout, to look at how doctors can diagnose their patients better, and so on and so forth, right? So
Hmm.
that's kind of my answer. Yeah.
And that's fantastic because it nicely segues to my next question. You mentioned telehealth with that. So, Suresh, let me get your response into this. Considering, with advances in telemedicine happening, is the biggest paradigm shift enabled by technology going to be more a decentralized approach with remote or home based care using sensors and devices, and hospitals, say, being reserved for surgeries, or acting as a command center using cloud based solutions for remote monitoring and analysis of patients? How is your enterprise sort of geared for this shift to minimum care in hospitals and maximum care at homes?
I think that that's the direction broadly we would like to go, right? I mean, I think that as a consumer, as a person who's absorbing these services, that's the patient and the family, they want convenience at home or near home, right? and near home solution is as important as at home wherever applicable. But I think the way we look at it is to see where the expertise and the infrastructure is available for delivery of those services. So when you're looking at, for example, an MRI scan being a technology that you to do for diagnostics, you have to basically do it near home maybe, and then integrate that data to wherever the patient is and the provider and the doctor is, so that they can see all of that happening. Today, we're already doing that. For example, we are leveraging radiology data from wherever the doctor can see. Our radiologists can log in and see that remotely, and they're able to report remotely, real time, from wherever they are for an emergency or for overnight services. So they don't need to come to the hospital. It's cutting down time, it reduces the time. Same for the patient. So every aspect of care that can be taken near home, I think you will see that going, because you have access remotely or there is a virtual method. And with 5G, maybe even the services that you can deliver potentially can be enhanced near home or at home. We expect a lot of that to move that way. We're already doing a lot of daycare chemotherapy, daycare surgeries. Radiation is already daycare. So essentially, the number of days of stay in a hospital is shrinking. The number of days that you need to be inside a hospital is now limited to the more complex work of a prolonged illnesses, of a monitoring, which you cannot do in an otherwise in a home situation, or the infrastructure doesn't permit you to do it near home or at home. So hospitals are becoming more super specialized in that sense, and I see that becoming the trend going down the path for the next decade for sure. So our challenge is to figuring out how these various pieces of the transactions that have been done over a period of time for the patient is now visible to a provider real time on their mobile phone or tab or whatever. And that is where I think the world is moving to. And we're already seeing that. We're already actually having real-time access to our ICU data today on our apps. So all our clinicians can see what is happening inside our ICU, which was not possible earlier. In fact, we were not even monitoring in the past so frequently because it had to be manually done. But now, because it is real-time monitoring, we actually need to parse the data. We need to say, okay, I don't want real time. I want only every 10 minutes. Or if there is an alert, please let me know, because I don't want to know so much information. It's the other way around, really. So I completely agree. I think tele is the way. It's a lot of other technologies, I think, are coming together. The mindset has definitely shifted with COVID. The consumers, the doctors, both are now amenable to this whole idea. And the overall experience has been enhanced because of, I think, the cloud definitely coming into play, and bandwidth broadly becoming more available, I think, has, and the cost reducing, and nobody wants to really travel in traffic anyways. So I think all of that is definitely moving towards a decentralized approach in terms of delivery.
All right. Taking a cue from what Suresh spoke about where the space is heading to, Deepak, I want to get your thoughts in before we look to wrap up the conversation. Where do you see the next big disruption enabled by technology coming from in terms of transforming the way you operate in the healthcare space? And how do you see it driving positive outcomes for patients?
So Gautam, I think rather than calling out one or two key hero aspects, I would say that there are a lot of advances that are happening. Cloud is definitely an enabler, as Suresh mentioned, from a infrastructure perspective, cost perspective, and letting experts do what they are good at. I think from a patient perspective, definitely they're looking for instant gratification. We took cues from multiple other industries in the past, and we have spoken about the advents of telemedicine. We have seen the proof of that during pandemic, and it continues to hold ground. What is important is how do we enhance that patient experience, and our research, the workflow that we have designed from a clinical trial journey perspective and other use cases also supports that, corroborates that, it will boil down to how are we improving the experience of all the stakeholders, including the patients. I would like to call out providers and hospitals as a very important stakeholder in this. And the examples that we have discussed in oncology, the advances in precision medicine, drug discovery. I think the next decade or so, we are going to see a lot of disruption, and India is again very well poised to play a very important role in that direction, Gautam. The leveraging electronic medical record, fetching that in real time, sharing that with patients and other providers, leveraging claims data, insurance claims and laboratory data. Early days in India, but I think those are early signs that we are seeing that with the help of technology and centralization of the modeling and AI ML tools helping us, while the operations are decentralized for efficiencies, is what the future should look like.
Shavankar, where do you see the next big disruption enabled by technology coming from in terms of transforming the way you operate in the healthcare space? And how do you see it driving positive outcomes for patients?
There are a couple of area where estimated potential economic impact when technology will be adopted. One is for the healthcare, particular healthcare industry. If I mention, one is your next gen sequencing and genomics will be the biggest boom for next couple of years, and it will handle big data. And in healthcare, it's a huge data sets already available. And 3D printing will be another scale of technology which will be scaled up huge. And AI ML already gearing up in the healthcare industry also. So these are the 3-4 things which will be more prominent in the next couple of years. And particularly if I say genomics and next-gen sequencing, Manipal as an organization already step in, and we are talking to a couple of tech partners, a couple of healthcare partners also, where we'll be taking this leverage to boost up our genomics platform and genomics data. And another thing I should mention that it's not directly with IT operations in healthcare. It is clinical operations where advanced robotics will be a kind of feature technology which will emerge.
All right. Siddharth, let me bring you in for the last word. Considering the surge of innovations expected to come in, how do healthcare enterprises evolve their cloud health strategies from here to keep up with the rapidly changing data and outcomes landscape?
Sure, Suresh. I think okay. So I think let's take a step back, right? I think firstly, right, just as cloud has evolved, right, uh, you know, any cloud, right, and specifically Google Cloud, is a fully HIPAA compliant cloud solution, right? And we have security built into all the layers uh, of infrastructure and application and data that exists, right, in Google Cloud. Google Cloud is the only cloud that encrypts your data by default at rest and in transit, right? So the notion that patient data is not secure in the cloud kind of needs to go away, right? And I think that's the first place to start, because we see a lot of hesitation with customers saying that, hey, I can't put my data into a public cloud, but the cloud is more secure than the data sitting in your environment, right? And that is a given, right? uh, so a great place to start, right? I would say, almost, you can look at three areas, right? But I think starting a great place to start would be looking at your infrastructure that exists within your four walls of the data center, right? A great way for you to look at is, which applications today are sitting on legacy hardware, and do you really need to buy the next servers, right? Do you need to invest in putting up infrastructure within your premise, right? And the answer should be no, right? And you should look at how you can move those applications to the cloud, right? And there are enough tools today that exist to help you do that. The second is look at your applications that have been built in house, right? Are these applications today legacy applications built on monolith technology, right? How do you take those applications, re-architect them, convert them to microservices, and then move them to the cloud using the power of Kubernetes and serverless infrastructure, right? And Google is a big proponent of everything being serverless, right? Because today, honestly, we run the largest cloud in the world, where 9 of our products, Google products today, have 1 billion users each running on the same infrastructure that we're making available to our customers, right? And I would say the low hanging fruit that exists today for healthcare and pharma companies is to look at their data journey, right? Today, data, again, right, at the cost of repeating myself, I'll say is the most valuable currency in healthcare, but most underutilized, right? You should be looking at building your data lakes into the cloud, breaking the data silos that exists, because these are just blocking innovation, right? I mean, even forget AI, machine learning, right? These are blocking, simple BI reporting, right? For you to understand today, how are your financials shaping up, what is your inventory looking like, how do you do demand planning, all of that today it takes days in most enterprises to get this data out, right? And today, moving this to the cloud and really helping you break those data silos is a great place to start. And then you look at how you can take the data that you have, and specifically for providers, you look at patient data that you have today. How can you de-identify that data, move it to the cloud, encrypt it? All of this happens as a standard in Google Cloud, and then you drive AI, machine learning, and the really cool use cases that we've spoken about, so that you're helping doctors, you're helping patients, and you're helping the overall healthcare ecosystem, right? But cloud has to become a critical part of this journey, because it's just not possible to do any of this, within your four walls of your data center. Yeah.
The cloud enhancing data journeys to enhance patient journeys. On that note, it's time to wrap up our conversation around reimagining healthcare with the cloud as part of our special series titled Money Control Innovation Next, presented by Google Cloud. I'd like to thank all the panelists for connecting the dots for us on how digital first initiatives powered by the cloud are unlocking new possibilities for the healthcare sector. And of course, thank you to our viewers for tuning in. Till next time. This is your host, Gautam Srinivasan, signing off. Have a great day.